Mount Sinai Hospital of Queens is the only community hospital to bear the prestigious Mount Sinai name. This has proved tremendously important for the hospital, the staff, and the community. Dramatic changes have been made at Mount Sinai Queens over the past 7 years, from the complete renovation and expansion of its emergency department to the opening of a new imaging suite with the hospital's first MRI and second CT scanner. The changes at Mount Sinai Queens have been dramatic, yet it is time to take it to the next level. Time to ensure excellence in patient care and service. Time to forge new relationships between management and labor. Time to cement Mount Sinai Queens' position as the region's premier community hospital.
We've had an amazing 7 years at Mount Sinai Hospital of Queens since we became part of Mount Sinai. We've made so much progress, whether it be renovations, including renovation and upgrading of our emergency department, adding new programs such as the stroke center, improving quality of care. We couldn't have made nearly as much progress without the support of our incredible staff. We really do have an amazing team here at Mount Sinai Queens. But it's time to take it to the next level. And we're very excited about the potential for a partnership with labor management, which I think will provide the springboard for getting us there. Yes, we need a new building, and we also need new technology. But at the heart of a great hospital is the people that work there. And I believe we have the makings of a great hospital. And I also believe we now have the recipe for success to get us there, working together as a team, management and labor together.
Mount Sinai Hospital of Queens has already initiated a number of programs where labor and management are working together to improve the patient experience.
I've worked on every single unit at Mount Sinai Hospital Queens. I felt that it was really important for me to do that in order to understand what some of the obstacles were that the nurses had in trying to deliver terrific care to the patients. One of the overwhelming observations that I made is that the majority of the patients that come here for services are the frail elderly. And the two areas that we began looking at were fall prevention and pressure ulcer prevention.
And we were privileged to enter into a breakthrough project with labor management, and we termed our project Fall Breakers. And this was an effort on our part to ensure great quality care for our geriatric population, and it led to a great reduction in our fall rate on our med-surg unit. Our overall fall rate has dropped considerably, and we're successful.
Pressure ulcers are common in a variety of settings and are associated with adverse health outcomes as well as increased costs. Our goal here at the Mount Sinai Hospital of Queens is to update our policy and procedures and implement specific clinical guidelines based on the best available evidence as well as expert opinion related to pressure ulcer prevention and treatment. It is through the generous support of an $11.99 grant that we were able to bring a world-renowned expert in wound management to lead clinical rounds here in Queens. These clinical rounds have sparked tremendous interest and enthusiasm among the staff. To continue this momentum, I have initiated weekly clinical rounds to evaluate the treatment and progress of patients that have wounds throughout our hospital.
When we decided on those activities, we reached out to our colleagues at 1199, and we had overwhelming support for getting the nurses the kind of information that they needed to improve the way that they were caring for patients that fell into these two high-risk categories.
A linchpin of excellent patient care and service is communication. One of Mount Sinai Queens' projects, relationship-based care, is all about communication. Communication with the patient and family, and communication among the care team.
Relationship-based care has had a positive impact on staff because it allows us to solve problems at the unit level. They have seen the impact of relationship-based care on patient care. The patients are able to recognize their nurses when we do our courtesy calls at home. Especially in the hospital, the patients are able to recall nurses from past care.
I've been so impressed by the spirit at Mount Sinai Queens. As one of the newest members, you cannot help but catch the enthusiasm shared by the staff. I've witnessed firsthand how well labor and management work together as a team. The commitment is there to work together as labor and management, as well as building bridges between Mount Sinai and Mount Sinai Queens.
These projects and more, including medical interpretation, operating room technical training, and a special project to reduce sick time, are just the first steps in creating excellence in patient care and service.